الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Hepatitis C by Professor Mahmoud Hani Sulaiman. Infectious agent hepatitis C virus is a small RNA virus. It is closely related to flavivirus and animal pestivirus. Epidemiology. Hepatitis C occurs worldwide, injecting drug users at risk of HCV infection. 3/4 of HCV infected persons will have chronic carrier state. Of those chronically infected, about 20% will have liver cirrhosis in 15 to 40 years. About 5% will become hepatocellular carcinoma in 40 years. At least 6 major genotypes of HCV present. Reservoir equal humans. Mode of transmission. 1. Hepatitis C mainly transmitted by blood-to-blood contact. In Western countries, sharing of injecting equipment by IV drug users is most common mode of transmission. Tattooing, ear piercing, and body piercing using unsterile equipment are other sources. Increased prevalence of HCV in prisons due to increased likelihood of injecting drug use and tattooing. Mode of transmission 2. Healthcare worker handling blood and blood products are at increased risk of HCV. Risk of contracting hepatitis C after percutaneous exposure as needle stick from blood of a person with hepatitis C antibody is at 0 to 7%. Risk of transmission is negligible if source is HCV RNA negative. Sexual transmission. Rates of HCV is very low. Sexual transmission of HCV is very low. Risk is increased if HCV positive partner has decreased immunity due to viral blood titer may be increased, or when there is possibility of blood-to-blood contact, e.g. sex during menstruation and traumatic sexual practices. Modes of transmission 3. Mother to baby transmission is about 6% and occur only when mother is HCV RNA positive. Possibility of transmission increased if mother is also infected with HIV. Although HCV was occasionally detected in breast milk, there is no evidence that HCV is transmitted from mother to child by breastfeeding. Community or household transmission of HCV is rare. Mode of transmission 4. A percent of HCV positive individuals do not fall into any known risk of subgroups. They may be called idiopathic. They may forgot exposure to injecting drugs many years ago, or they may be unwilling to discuss this. Reuse of poorly unsterile needles by healthcare workers and others in some countries, and cultural practices that involve skin piercing are other potential sources of infection. Period of communicability. Communicability occurs during acute clinical stage of HCV infection and indefinitely in chronic carrier state. All HCV positive individuals considered potentially infectious, although risk is minimal in non-viremic PCR negative individual. Susceptibility and resistance. Non-immune people equal susceptible to infection. Degree of immunity after infection is uncertain. If infection resolves and the virus is cleared, person can be reinfected with same and other genotypes, but there is evidence that likelihood of reinfection is decreased after first HCV infection. Incubation period from half months to 6 months. Most commonly 1.5 to 2.25 months. Then serum ALT levels increase. Infection with HCV will lead to positive 2 to 3 months after exposure. Clinical features. Most HCV asymptomatic will lead to acute infection may only be detected by increased ALT. Because they are symptomatic, they may only be detected during increased ALT. When symptoms and signs occur, they are similar to other forms of viral hepatitis but usually milder. 10 to 50% of HCV completely recover and clear the virus in subsequent few years. Symptoms are non-specific, include fatigue, headaches, and nausea. Diagnosis: HCV confirmed using combination of HCV antibody test and PCR to detect HCV RNA. Positive antibody test equal previous infection. Positive HCV RNA equal ongoing infection plus viremia. Single negative PCR does not exclude infection. Viremia may be intermittent. Patient retested in 6 to 12 months. This is good guidelines how to interpret tests for HCV. HCV antibody negative on your left side. This means it is non-reactive, no HCV antibody detected. Stop any further tests. If HCV antibody is positive, this means reactive. This reactive patient do for him RNA. If it is negative, this means it is not detected, no current HCV infection. Antibody testing as appropriate after some while, 6 to 12 months. If it is positive, this means the RNA detected. Current HCV infection linked to care. The patient must counsel a specialist in liver diseases. Treatment. This is the scheme for treatment in US and it differs from country to country. Please ask the health authorities at your country about the guidelines for treatment. Please print this and use it if you need to use it. Preventive measures. Healthcare workers in contact with blood or body fluids must use standard precautions. We mentioned these precautions at the very beginning lessons and cultures of this series. Please read it. Single-use equipment for all skin penetration procedures and use, disinfection and sterilization when reusable instruments are used for any procedures. This includes needles. Control of case. Patient diagnosed as HCV infection reviewed by a hepatitis specialist and assessed for likelihood of disease progression. Treatment based on presence of liver fibrosis. Length of treatment and type of treatment depends on genotype and whether previous treatment failed. Combined treatment with alpha interferon, ribavirin, or pegylated interferon and ribavirin are possible treatment regimens. Please counsel hepatitis specialist. Control of case. Patient counseling is important in treatment. It includes exploring source of infection. Okay, trace the source. Give health education about natural history, symptoms, advice on prevention of transmission of virus, immunization against hepatitis A and B, minimization of alcohol intake, cessation of smoking, and decrease fat diet. Control of case continued. The patient should be advised not to donate blood or body organs, share injecting equipment. He must not share these equipments, not share personal items as toothbrushes or razors. Control continued. Control of case. Patient also advised to tell healthcare provider when doing dental, surgical, or medical procedure. Wipe up any blood spills with single-use disposable paper towels and clean the area with detergent and warm water. Cover any cuts or wounds with occlusive waterproof dressing. Place blood-stained paper tissues, sanitary towels, or dressings in a plastic bag before disposal. Control of case continued. Use safer sex practices for the patient. People in long-term stable relationships will need to discuss condom use with their health care provider. Control of contacts. No vaccine available for prevention of hepatitis C. Prophylactic immunoglobulin for contacts has no rule. Special settings. Antenatal care. Antenatal care should include a comprehensive assessment of hepatitis C risk factors. Women found to be at higher risk of hepatitis C infection or exposure should do hepatitis C antibody screening. Other settings, all workplaces, especially healthcare facilities, should have policies and procedures. Written policies and procedures in place regarding action to be taken in the event of a blood spill or sharp injury. Please, we mentioned this in the very beginning lectures of this series. Please read it. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.